Here's something I hear again and again from families. I wish I had called hospice sooner. And usually what that means isn't that they wanted their loved one to pass away sooner. They actually wish they had known what hospice could actually do for them sooner. Welcome back to the Medicine Path, where we explore the intersection between modern medicine and ancient wisdom. Today is Hospice Wisdom Wednesday, and we're talking about something that many families don't understand until they're suddenly faced with a serious illness. What families wish they had known before hospice is we're gonna go through a series of things, right? First, hospice isn't about giving up. One of the biggest misconceptions I hear is if we call hospice, that means we're giving up. No, it does not. Hospice means the focus of care is changing. Instead of primarily asking things like, what can we do to cure the disease? The conversation becomes, how can we keep this person comfortable, supported, and living as fully as possible for the time they have? That can mean managing pain, shortness of breath, anxiety, nausea, agitation, and other symptoms. And it also means supporting the family. Number two, you don't have to wait until the very end. Another thing families often wish they had known, right? You don't necessarily have to wait until someone is actively dying to involve hospice. Hospice is generally intended for people with terminal illnesses who are believed to have a life expectancy of 6 months or less if the illness follows its expected course. And here's the important part about that. That does not mean someone will definitely pass away within 6 months. Hospice patients can sometimes live longer and may remain eligible for continued hospice care if they continue to meet that criteria. Number three, hospice can be about much more than medication. Families sometimes think hospice is simply someone coming to the home with medications, but hospice often provides a whole team. It depends on the patient's needs and the hospice program that may include nurses, aides, social workers, chaplains, physicians, volunteers, and other professionals, right? And the goal isn't just caring for that patient, it's caring for the people who are caring for the patient. All right, number four, you can ask questions before you choose hospice. This is a big one. You don't have to wait until you're in a crisis to ask. You need to ask things like, would hospice be appropriate for my loved one? You can have an informal conversation, ask what services are provided, ask how often someone will visit, ask what happens after hours. Please ask who will you call when there's a problem, and ask what equipment may be available. And most importantly, what would hospice look like for our family? Please ask that question. Number five, hospice doesn't mean you stop caring. And perhaps this is the biggest misconception of all. Choosing hospice doesn't mean you stop caring for your loved one at all. Sometimes it means you finally get to stop spending every moment fighting the disease and start spending more moments being present with the person. Talking, holding hands, listening to their favorite music, looking through old photographs, saying the things you've been meaning to say. Sometimes the greatest gift a medicine can offer isn't another procedure. Sometimes it's comfort, dignity, and time together. So if your family is wondering whether it's time to have a hospice conversation, you don't have to figure it all out alone, right? Start by asking questions. Learn what hospice can and cannot provide. And remember, hospice isn't about giving up on a person. It's about making sure the person and the family are cared for when the goal of care changes. This is Hospice Wisdom Wednesday here on the Medicine Path, where we explore the intersection between modern medicine and ancient wisdom. Until next time, take care of your body, honor your spirit, and remember, there is medicine in being heard, there is medicine in being cared for, and there is medicine in simply being present. I'll see you next time on the Medicine Path.